Hi everyone. So this is Dr. Varsha Priyadarshini and I'm one of the mentors in Mrcog Cool, and I'm in charge of the surgical module with respect to Part 3 Mrcog. So today we'll be talking about the tips and tricks that will help you in passing Part 3 Mrcog with respect to surgical module. Now, to begin with, first of all, I would like to tell you that the Part 3 Mrcog is pretty different from Part 2 Mrcog in terms of that it mostly checks your communication, your language skills, and the way you gather your information in timely manner. Whereas in Part 2 Mrcog is checking your core depth, core knowledge. So although Part 2 Mrcog is the bottleneck, a little bit of training in Part 3 will help you pass it without any difficulty. So Part 3 Mrcog mostly consists of simulated patient tasks in which there will be a patient in front of you, just like in a natural clinical setting, and you would be required to take history and also make a diagnosis and provide the management plan to the patient in patient-friendly terms. Meanwhile, also, you'll be checked on your communication, your applied clinical knowledge, your history taking, and the patient safety. Now, coming to the surgical module, mostly the simulated patient tasks that you get on surgical module is mostly on the complications that happen post-surgery. It's just the most commonly asked question in surgical module. For example, a patient has just gone abdominal hysterectomy or a laparoscopic hysterectomy, and she may present with some complaints in post-operative period, and you need to make a diagnosis. It could be anything. For example, it could be a hematoma, it could be a ureteric injury, it could be a bowel injury or a fistula. So you need to take history, and it's very important that you take history in a timely manner and finish it within time. So mostly we see students taking a lot of time in history taking. So in the training we teach you how to take detailed focused history with respect to surgical module, what is more important and what is not important. For example, in surgical module, which is very important to ask the blood group and any kind of allergies, because you might need to give antibiotics to the patient. So it's an important patient safety point that one should not miss in a surgical module. Apart from that, what relevant history you need to take in terms of post-operative case in your patient is also what we teach in the training. For example, if a patient has coming with any kind of fever, and you need to ask from the patient what is it associated with, any abdominal pain, any tummy pain, any problem in the waterworks. So as you can see that we don't say any bladder problems, we say problem in the waterworks, which is a more patient-friendly term. So this is very important. Another important part of Part 3 Mrcog is to teach you what patient-friendly terms you need to use, which is more understandable to the patient. So then another part of history taking, we'll be teaching about the history taking and then how to explain the diagnosis in a very sensitive manner, because surgical complications, when you need to tell the patient about the surgical complications, they are obviously, you are expecting a reaction from the patient, which you need to tackle in a very sensitive, empathetic manner. At the same time, you need to also safeguard yourself in a you should not be over defensive and still not incriminate you or any of the colleagues. So these are soft skills that we teach, that how you should be explaining the complication to the patient in a very timely, in a sensitive and empathetic manner, how to break the bad news in a post-operative ward that yes, I'm sorry, a complication seemed to have occurred, and then how to deal with the reactions that come forward with it. Because you are expecting shock, you're expecting anger from the patient, so you need to calm that down. These are important soft skills that you need to master for Part 3 Mrcog in order to pass your exams. Also explaining the complication and how you're going to manage. Now, coming to the management, as you know, if there is an injury, you've been taught in part 2 MRCOG what are the details of how to repair that injury. But in part 3 MRCOG, this is not in simulated patient task. This is not what is expected out of you, to tell the patient the details of the surgery. Rather, what is expected out of you is to know your limitations, and you should be aware of what your team should be consisted. Who is going to perform the surgery? What is the basic surgery that will be done? And what will be the post-operative care? For example, if a patient comes with a ureteric injury, you need not tell the patient that you will be having a transuretrouretrostomy. That is not what the patient is interested in. You must rather tell that there will be a team of doctors who will be taking care of you, which will be consisting of a gynecologist, a urologist, or you can say a special surgeon who deals with these kind of injuries, and the OT team, the sleep doctor, and the blood bank as well. So the surgery, as we can say, that we are not going to tell about the details of the surgery, rather than we should be telling about a basic idea of the surgery which the patient should be aware of, and who is going to perform the surgery. You should be aware that you are not going to perform the surgery, so there's no I in this, that I will do this. The team of doctors will be taking care of it. Your job ends there, but you should tell the patient. Your job is to tell the patient as an ST5 as to who will be performing the surgery, what will be the team of doctors, who will be part of that team, and how will be the post-operative care. At the same time, you should be ready to answer questions like, I want to lodge a complaint. For example, the patient will be very angry and would want to lodge a complaint. Should be able to answer those questions, should need to pacify the patient regarding as to what will be the necessary course of action. How are you going to deal with this complication that this never occurs in future? So you need to give her those options that yes, we are going to lodge an investigation into this, and we will make sure that this never happens again. So you need to tell that patient about these things. So this is one of the simulated patient tasks that you might get in a in a surgical setting. Coming to the structured discussions, you might get questions on any kind of instruments, and you might be commonly asked about an instrument that is kept on your table, about the details, describe an instrument, then necessary questions about any kind of procedure that the instrument is used. For example, you might get a laparoscope, or you might get a forceps, and you might be asked questions about forceps delivery. This is a structured discussion setting, and you need not be talking in patient-friendly terms, because you're talking to your examiner, so you should be talking in scientific terms, and you can talk as much as detail as possible from your part 2 MRCOG knowledge. So here it's just like structured discussions, like you're speaking out your part 2 MRCOG knowledge as so the structured discussion is relatively easier for part 2 MRCOG candidates who've just passed. Another things that you can get is you can be talked about procedures like entry, laparoscopic entry, or cystoscopy, or hysteroscopy. So you can be asked questions about that. You can also get questions on discharge letters. For example, a patient has been discharged, and you are typically presented with a discharge summary, and you're asked by your examiner that what are the problems in this discharge summary, and you need to tell the patient, you need to tell your examiner that yeah, these are the problems and what should have been done, and what has been done that is right, and what has been done which is not right, and you have to point those things. So these are the typical things that are present in your surgical module. What is important is that you should be able to develop your soft skills for your surgical module, because it's a typical setting where patients are very, very angry with the complications of the surgery. Another thing that you can get in a surgical module is consent taking, in which you have to take consent from the patient for a typical kind of typical procedure, for example, abdominal hysterectomy or a laparoscopic ligation, you need to take consent from the patient. So what are the questions, what is the history taking that you're going to take from the patient, and how you're going to explain the consent. So it's not simply consent taking, you need to tell the procedure, the risks, the benefits, the alternative options that are present for the procedure, and then at the end, after the patient consents for it, you need to take a signature. Another important thing that you can get in post-operative is a pre-operative ward round, in which you are given a set of cases that are going to be posted for the operation theater next day, and you are, as an ST5, have to take a history in the pre-operative ward, and then accordingly you have to make a list for the next day and prioritize your cases in terms of the highest priority case to be kept first and why you should keep it, and then accordingly which should be kept in second, third and fourth accordingly. So in this we teach you how to take a history, and accordingly what you need to ask, what complications you are anticipating for the surgery, what you need to keep ready for the surgery next day, and then accordingly how you need to prioritize the cases. Again, you might also get a post-operative ward round, in which there are 3 or 4 cases that have been operated the day and are in the post-operative ward, and then accordingly you have to take a post-operative ward round, ask the patient's relevant history in immediate post-operative period, what you need to ask. For example, if there is a abdominal hysterectomy that has been done, you need to ask about how is she feeling. Is she feeling any dizziness? Has she passed has she passed her wind? Has she passed waterworks? So you need to ask about those questions in post-operative ward, and if there are any complications, if there is any problem that patient is having, you need to address that and do relevant investigations, involve relevant team. So I hope I've given you a basic idea of how you need to deal with surgical module, and in Part 3 MRCG training we help you develop the soft skills and also tell you the relevant we work on your communication, language and the skills that are needed to part 3. So I hope you have had a good idea of surgical module, and let's meet you in the training. Okay, bye.